Hi guys, welcome back to the healthy topics. First and foremost, I like to thank for everyone for subscribing this channel. So we are going to start with part 2 of the dengue fever. So whoever has not seen part 1, I request everyone to see part 1 of the dengue fever. So coming back straight to the part 2 of the dengue, here we are going to discuss basically the management of the dengue fever, which is very important in our day-to-day practice. So this management basically is divided into two parts. One is prevention, second is the treatment. So prevention, as we saw in the part 1, the causative agent, the vector for the dengue fever, it is Aedes aegypti mosquito. So prevention, first and foremost, this Aedes aegypti mosquito will breed in the open indwelling water. That means stored water which has been opened, like especially during rainy season. This mosquito going to breed and going to cause the transmission of the infection. So for the society, for the people, so kindly avoid storage of water near your homes. This can prevent maximum 70 to 80% of the dengue transmission. Alright. So basically this prevention, which is very effective, very much effective in prevention of dengue infection. And dengue day is celebrated on June 15th of every year. Recently Asian, that is Asian has celebrated a dengue day in Malaysia. Alright. So coming to the dengue part, how do you are going to treat the dengue infection? Prevention, does it contains any vaccination? Yes. Recent phase 3 trials are happening in the America and Asia, that is dengue vax. Still it has not come into the society, so hope we expect it to come to the society and patient get dengue vaccine. Coming to the treatment aspects of the dengue fever, you are going to treat the dengue fever based on the stages of the dengue infection. Basically, dengue infection is divided into clinically. Once patient develops dengue infection, he gets into 3 phases. One is the febrile phase, second is the critical phase, third is the convalescent phase. So in febrile phase, patient usually have viral infection. That is, patient will have fever and dehydration. So once this patient, you are going to treat this patient at this stage, maximum mortality is very negligible. Say it is 0.5% of the mortality. Coming to the critical phase, here the most important part in patients with dengue infection is usually patient is afebrile. Patient will continue to have dehydration. Along with that, patient will have what is called as plasma leakage. Plasma leakage will further see this in detail in the warning signs. Alright. So here the critical phase, the name itself says it's a very critical stage. You are going to treat the patient and you are going to have a warning signs in a dengue fever. What are all the warning signs? I'll just highlight you for all the doctors who are going to treat for the dengue, like general practitioners, physicians. Okay. So first and foremost, the patient will develop what is called as narrowing of pulse pressure. What is this pulse pressure? Is nothing but difference between systolic blood pressure and diastolic blood pressure. So once patient who develops, first say like first day you have seen the patient with a BP of say 120 by 80. So over a period of second day, third day, if suppose the patient develops what is called as 120 by 110, this should alarm all the clinicians that patient is developing what is called plasma leakage. This is very important. Kindly note, all the practitioners, first sign for the warning sign is narrowing of pulse pressure, which is very important in pediatric age groups and elderly age groups. Other warning signs includes hypotension. Patient will have decreased urine output. or patient have no urine output, that is oliguria or anuria. Patient will have organ impairment. This is very classically in my clinical practice we see most commonly involved is liver presents with hepatitis, heart it presents with myocarditis, CNS usually with encephalopathy, seizures, altered sensorium. Okay, so these are the warning signs patient can present in dengue critical phase. Once you treat this phase very properly and methodically, patient goes for what is called convalescent phase. Patient here usually will have afebrile and patient is in hypervolemia, and this hypervolemia state is maintained by giving only IV fluids. Alright audience, so this is the main 3 phases of the dengue fever, and these phases can overlap each other. So you are going to take the decision based on the patient profile. Okay, so these are the things. And acute hepatitis, usually we see elevation of AST and ALT. According to the books, what it says, you should be more than 1000. Even we see with mild moderate elevation of hepatitis. And in my clinical practice, I have seen 2 to 3 cases of myocarditis where patient presents with palpitation, patient presents with hypotension. Okay, so coming to the severe dengue. What is this severe dengue? Everyone says dengue jara jasti agide. What is severe dengue? Severe dengue is nothing but dengue hemorrhagic fever. Usually will have patient hypotension, narrowing of pulse pressure, decreased urine output, and other thing is organ impairment. This is very classic of severe dengue. Alright, so coming to the treatment aspect. Once patient comes to your hospital, how you are going to do? The main course of the treatment is IV fluid. IV fluid of choice is RL-NS, that is normal saline and ringer lactate. Please kindly note there is no role for DNS. Okay. So coming to the how you are going to treat. Once you are going to see, you will start with treatment initially 7 ml per kg per hour. That means say patient is weighing around 60 kg, 60 into 7, it is 420 ml. So 420 ml should go in 1 hour. Suppose patient develops improvement, you are going to reduce this 7 ml to 5 ml per kg per hour. Again you assess every 24 hours, improves, again you reduce to 2 ml per kg per hour. Then you are going to discharge the patient. Coming to the patient who has not improved. So initially you started with 7 ml, you are going to increase to 10 ml. Again you assess the same over 24 hours. That is what all you are going to assess. Number 1, hematocrit, which is dealt in detail. Okay, then blood pressure, urine output. These are the 3 things you are going to assess the patient in dengue fever. If it is no improvement, again you increase to 15 ml per kg. Again if it is not improved, you are going to transfuse what is called colloids. Okay, colloids. Sometimes you transfuse the platelets. All right. Okay. So this is and we commonly see the role of doxycycline. Yes, it has been approved by International Society of Infectious Disease that doxycycline has a major role in dengue infection. Number 1, it reduces what is called cytokine storm. All right. So this cytokine storm is responsible for majority of the clinical picture like plasma leakage. Okay, hypotension. Okay, this is going to reduce. Second, it decreases the viral entry. Doxycycline reduces the viral entry into the cells. Okay, and it also kills the dengue virus. That is dengue virus 1, 2, 3, and 4. Okay, so these are the things. Coming to the hematocrit value. What is this hematocrit value, which is very important in assessing the severity of the dengue infection? So hematocrit is nothing but what is called as your packed cell volume of the RBC divided by total blood volume. So total blood volume, it is a ratio, the packed cell volume divided by total blood. Once total blood volume reduces your hematocrit reduces. So a mean rise of 20% of the baseline of the hematocrit patient once get admitted, you should get alarm that patient is developing plasma leakage. Plasma leakage in the sense patient can develop in the form of ascites, pleural effusion, okay, that is nothing but fluid collection in the abdominal cavity and lungs cavity, okay. So these are going to this hematocrit very important. But in our clinical practice, what you see as you do a PCV, packet cell volume. Otherwise, you are going to calculate this packet cell volume into RBC count. You get the hematocrit value. However, the recent technology has developed what is called analyzer, blood analyzer, where you get directly hematocrit. Normal hematocrit for the male is around 40 to 50. And females it is 30 to 40. So these things you are going to monitor clinically, okay. And hematocrit plays a very important role. And second is narrowing of the pulse pressure. These things are to be remembered. Coming to the public part, where where the general public, what are the take-home messages from the dengue fever? One thing: don't allow water to get stagnant outside your houses. Which is a place for breeding of mosquito, since this mosquito takes place in the transmission of the dengue infection. Avoid mosquito bites by applying the mosquito repellents. Alright, so these are the things which is very important in the treatment of the dengue infection. Hope I have cleared most of the doubts of the dengue treatment. Please kindly leave your comments leave your comments, and if you have any doubts, please leave in the comment section. I am very happy to answer you. Alright, and I thanks all of you for subscribing my channel, Healthy Topics. Again, I will come back to you with which is very say like publicly important topic, and it is very much discussed. Alright, okay, see you, bye.